If you don't agree with a decision made by the federally facilitated marketplace, HealthCare.Gov, you have the right to appeal that decision. Generally, that's going to be a question of eligibility. You either think there was a mistake made in determining if you're eligible for a plan, or you disagree with an eligibility determination made by the marketplace. Now, this process is separate from an appeal to an insurance plan. Say you want to appeal a covered service. That is not through the federally facilitated marketplace. You go right to your insurance company for that conversation. What can be appealed? Well, it could be eligibility to buy a qualified health plan or a catastrophic plan. Maybe it would be eligibility for or amount of premium tax credits or cost sharing reductions. Could also be your eligibility for a special enrollment period. Those questions can be appealed to the federally facilitated marketplace. Now, in only a few instances, some states have designated the appeal of some Medicaid denials to the federally facilitated marketplace. There are only about 8 states that do this. The description below, we link to those states so you can see if your state has designated this function to the federally facilitated marketplace. But that's the exception more than the rule. Timeline. Generally, you have 90 days from the date of your eligibility notice to ask for an appeal. If you miss that deadline, you may qualify for good cause extension. You would simply explain the reason for the delay, and you can do that right on your appeal form, or you can put a letter in with your request for an appeal explaining why you might have missed that deadline. But generally, try to do it within the 90 days. The more prompt you are, the faster it can be resolved, and the less chance there is that there will be a gap in your health coverage. How to do an appeal. Like we said, there's a form. You can find that right on HealthCare.Gov, the marketplace website, and we give the link in the description below. You can also send a fax. You can download that form and fax it to the marketplace or put it in the US mail. That contact information is also below. Once it gets to the Marketplace Appeal Center, they're going to assess the validity of your appeal. First of all, for timeliness, they're going to see if you did it within those 90 days or if you had a good explanation of why you might have been late. They're going to determine if it's a matter that can be appealed at all. They say generally 1 in 3 appeal requests are invalid, mostly because they're appeals for insurance plans, not for the marketplace. Remember, it's a question of eligibility for the marketplace or for tax credits or cost sharing reductions more than any other issue. They're going to see if it was requested, if the appeal was requested by an authorized person. An authorized person is either the consumer herself who was purchasing or trying to apply for a marketplace plan, or someone that person has officially designated to step into their shoes, someone that can act on your behalf. That could be a family member, an advocate, an attorney, a navigator, but that person needs your permission. It has to be in writing and it has to be signed. Then they can step into your shoes and work through the appeal on your behalf. Now, if you designated someone to help you apply for a marketplace plan to begin with, that's not the same person that would be someone you could designate for the appeal. You could have that same person serve both functions, but you would need that separate written request and signature about the appeal distinct from that request that you made when you were doing an application in the first place. That initial approval of someone to help you doesn't carry over to the approval process. You have to do it again. Now, this authorized representative is going to be the primary contact through the appeal. So if you want to have a role in this appeal and submitting documents, you would want to keep yourself as the primary contact and maybe have somebody help you. But if you want someone to do it for you and you designate them to step into your shoes, they're going to step into your shoes for the providing information, for providing additional documentation, for returning phone calls, attending conferences. It's the whole kit and caboodle. The marketplace has a form you can use to designate someone to step into your shoes, and we link to that authorized representative form in the description below. If it's a valid appeal, you go through these steps, they validate it's an appropriate question, it was received in a timely manner, the appropriate person is making the request, you're going to get a letter from the marketplace. It's going to have an appeal number on it, your designated appeal number. Save this number. This is the way they identify it's you and your issue. Put that number on any document you submit to the Marketplace Appeal Center. The letter's also going to include a description of the process and any other materials you may need to submit at that time. It's going to give instructions. Make sure you read that carefully. Informal resolution is what the marketplace tries to prioritize. If they can take care of this appeal by just reviewing the information they already have and maybe asking you a couple more questions, they're going to try to do that. They may call you, they may send you a letter, and in the near future, they're going to start sending emails. They're not at the email stage yet, so you may expect a call or a letter from the marketplace asking for more information or clearing up the information they already have. The decision, if satisfactory to you, the consumer, is binding. If it's not satisfactory, you can actually go past this informal information stage into an actual hearing. A hearing is a more formal process. There's a hearing officer. It's a federal hearing officer. He's going to put everybody under oath. If you have witnesses, if you have other people you want to speak at this hearing, everybody's under oath. You do have the right to call other people to speak during this hearing. If it's a question of household members, for example, for eligibility, you could ask one of them to speak up during this hearing. The hearing officer then has 90 days to issue her decision. They do have a little asterisk that says as administratively feasible, so be prepared for a little bit of flexibility on that timeline. It's generally 90 days. Once that decision is made, it is largely binding, but you do have the right to judicial review. If you don't agree with the hearing officer's decision, you can always take it to court. Hearing outcomes could go either way. If the marketplace was correct and you are not eligible, there's no change. You're not going to get the coverage moving forward. If the marketplace was incorrect, the consumer can have their eligibility reinstated retroactively back to the date of that incorrect determination. This may mean that you'll have to reconcile some information, maybe some money. Maybe you've been paying too much in premiums and you are owed a refund. That reconciliation will happen back to the date when they first said you're not eligible or you're not eligible for tax credit. So whenever that wrong decision was made, that's when the notice of the change of decision from the hearing officer backdates to that date to then make things right. Either way, you're going to get a letter that's going to tell you the decision of the hearing officer, how it was reached, and any next steps. Couple tips as we wrap up here. Save a copy of everything. Forms, materials, letters, documents, anything you submit or anything you receive. Save a copy. Create a binder and save your appeal copy. Keep careful notes. Anybody you talk to, if the marketplace calls you, take notes on that call. Who were you talking to? What's their title? What were some of the notes on the conversation you had? Did they give you next steps? Make sure you write those down. Did they give any deadlines? Again, keep careful notes on all of the conversations you have. Put your appeal number on everything. Also, keep an eye on the calendar. There are a couple deadlines like we talked about. Those deadlines are very important. There may be flexibility, but it's not guaranteed. You can also expedite your request. If it's critical to your health or to your life, you can ask for your appeal to be expedited. There is a process to do that on the form. Help is available. If you worked with a navigator as you were initially applying for a marketplace plan, or a friend or a certified application counselor or an attorney, those are the same people that may be able to help point you in the direction of some local help during this appeal process. You could also call the marketplace call center. If it's before the appeal is filed, if it's in the pre-appeal stage, you can call the marketplace call center and start asking some questions. Once you've filed your appeal, your questions will then go directly to the marketplace appeal center. We give the phone number for both of those call centers in the description below. And like we said, you can find local help on HealthCare.Gov. Here in Wisconsin, we have wiscovered.com. Great resources for finding help in your area.